Incompetent cervix is the premature dilatation of the cervix. As we know, we want the cervix to stay closed until the pregnancy reaches at the term. But in this situation, in incompetent cervix situation, the cervix gets dilated prematurely and client experiences vaginal bleeding. Fetal membranes can be visible through the cervix and the pregnancy loss occurs. When does this occur? Mostly it occurs at the 4th or the 5th month of pregnancy. Is it structural or functional problem? It is actually both. It can be a structural malformation of the cervix, or it can be a disorder of the functioning of the cervix. Medication or surgery. How do we deal with this situation? The surgery that is done in incompetent cervix is called cervical cerclage. And then patient is recommended bed rest. Patient is also, physician may prescribe the tocolytic medications to the patient. Can you recall any tocolytic medications and their action? Tocolytic meds, they inhibit the uterine activity, and commonly used tocolytic medications, it can be nifedipine or it can be indomethacin. On the next slide, we're going to discuss cervical cerclage. What is this? This is a surgical procedure that is used to surgically close the cervix, in which a non-absorbable ribbon or a band of fascia is used to close the cervix. When to perform? When is this procedure performed? It is usually performed at 10 to 14 weeks of pregnancy. Post-procedure restrictions. We would advise the client to avoid intercourse post-procedure, avoid heavy lifting, avoid prolonged sitting and standing. Monitoring. What would you be monitoring your client for? We will be monitoring for bleeding, any signs of infection. We will also monitor the client for to have uterine contractions. When to call the primary healthcare provider? The patient requires to call the primary healthcare provider if any of these conditions occur, like bleeding, infection, uterine contractions. Then you would advise the client to call the physician. Removal. When is this cervical cerclage removed? It is removed at 37th weeks of pregnancy, but however, if the patient is going for cesarean section, then it is usually left in place. That's all about cervical cerclage. Thank you.